The views and opinions expressed on Real Talk with Horace Sheffield are not those of WADL TV 38 or Adele Broadcasting Corporation.
Giving you real talk, real talk, real talk. Take a walk down this path through Detroit, This is real talk, real talk, real talk. Real issues straight from the heart. Giving you real talk, real talk, real talk. Take a walk down this path through Detroit, This is real talk, real talk, real talk.
Welcome to Real Talk again. This is another segment talking about COVID-19, and I've been blessed to partner with two people who are connected to two organizations that Dabo's had a long history and a long relationship with. First of all, my far left, Dr. Levy, who is known all over the city for all kinds of trials and research that addresses health disparities, and we'll talk about that in relationship to COVID-19. And then Mona Makki, who is with Access. And we've had a long history. Ishmael Ahmed used to be on our board here at Dabo. And so we've always tried to interconnect the ethnic communities because we all kind of go through the same thing. It comes from different sources, but it has the same ugly face. So welcome to the show. We'll start with Mona. Tell us about Access and how you guys got involved in this whole testing regimen.
Well, Access is the largest Arab American community nonprofit in the nation. We've been serving the community now for over 49 years. And we have over 120 different programs, and we have our national programming. And how this kind of happened is when the pandemic hit the state, it was affecting people in the surrounding community, and we knew right away that we needed to do something. And so we started the conversation with Dr. Levy, who really was the vision around this project, and with UPG, and we just started kind of brainstorming and thinking, what is it that we can do? And one of the things that came to mind was really about testing. We knew that there was a huge need, and we were also looking at the governor's executive order in terms of who can be tested. So as soon as we came together and realized that's what we were going to do, we then, came together, and probably March 20th, we were on the ground testing essential workers, healthcare workers, and first responders.
Yes, so Dr. Levy, you and I met through this whole testing regimen. I got into it primarily because I had COVID-19 and I was kind of concerned about access. Number one, I didn't have a temperature, didn't have the normal symptoms, and some of the things that would have prohibited me from being tested bothered me because I didn't have those. So tell us how you got into this and some of the concerns you have about the whole regimen.
So as Mona mentioned, quickly after we recognized the first cases here in Michigan on March 10th, we stood up testing for first responders and healthcare workers, but at the time you had to be symptomatic. Yes. And what we wanted to do actually when we first started talking about all of this was test everybody. Because what coulda, shoulda, woulda, at the time happened, if we tested everybody and we found out those who were infected but asymptomatic like you, we could have prevented the spread to everyone else. But instead, for the right intentions, right, or at least the right reasons, testing was limited. There was not enough test kits, not enough availability of reagents and all the like to make the diagnoses. So the state had to do what it had to do in order to ensure that those who need to test most get the tests. But in that, the failing of the larger public health infrastructure of this country led to the spread of this through communities like the one you serve here in Detroit, because there were folks who didn't know they had the virus, walking through the streets, going into stores and doing all those types of things unbeknownst, right? Not intentional. And so what we really should have done is tested everybody from the very beginning, and now we're trying to play catch up by testing as many people as we can. But as you know, as I know, as Mona knows, because we're doing a lot of this testing, we're seeing a lot fewer positives. At least by the test for the virus, what we call the molecular test. And we're starting to...
That could mean they've already had it, which is why the blood test is important.
Correct. And so that's why at your site, the first site in the nation to offer serology testing to the community, we started drawing blood to understand this. And the data from your site showed that 25% of the population of the people that we tested were positive for the antibodies. That means that, a month later, we're able to show that they were infected a month ago. Had each one of those people been detected a month prior, maybe we could have prevented some of the spread.
So from a non-science standpoint, Mona, he touched on something that we've gotten letters, emails, have a member of my church who was working every single day kind of almost not taking this seriously at all, came here, got tested, found out she was positive. I mean, what impact doing community testing has on, you know, people's sense of, okay, I know I have it, I don't have it, or I don't have it, I now need to redouble my efforts. I mean, there's got to be some you know, positive outcomes from the actual community testing.
And I think being able to go out to the communities, I think, and partnering as we did, right, here at the Sheffield Center and with the community, having a safe place to go, I think was very important for folks. And that kind of just led more people to come out and get tested and to learn more about, you know, how to protect themselves. So I think community partnering and going out to the communities is extremely important. You know, there's a lot of issues around trust as well and all the misinformation that's out there. And being able to come to a trusted community center, I think, and partners coming together, I think has really allowed people to step out of their fear and actually get the test.
I thought we were passing out gold the first time. There were so many cars, we had to have the police direct traffic. But let's touch on what she's talking about, because I'm on Facebook promoting testing, and I have all these almost nuts, near nuts. I'm not in a position to diagnose them, but if I could, you know, I would say they have something going on, who talk about all this kind of other stuff, subterfuge related to testing, that, you know, the virus was created as a way to eliminate the minority population. The testing is faulty. So you've heard all that, haven't you?
Yeah, I've heard it all, and I think that to some degree, this is what happens when you have misinformation and when you have fear that's created because we don't have enough information. And so what didn't happen early enough on was we didn't normalize the infection. So everybody fears still, and feared then, that if they got the infection, they would die, because everybody's talking about the high case fatality rate. I mean, you're, you know, living proof that you can survive the virus, right? But in the beginning, all you hear about is you get on a ventilator, you're going to die from this virus. And it is a very dangerous, bad virus to get. But the vast majority of people, 98+% of them, are going to survive the virus. And so instead of creating the fear in society, had we normalized it by showing that most people who get infected do just fine, we could have changed some of that. And that didn't happen. And so what are we left with? We're left with people who feel that this was created to destroy a segment of the population, and it was allowed to run rampant in a segment of the population.
And a lot of misinformation from the beginning that African Americans can't get this, you know. I mean, just a lot of stuff. So let's just bring it home then. And both of you tell us, why is it important for people to be tested? I know you're still doing testing. I'm doing testing. I think it gives, from what I see, a sense of ease in some people's minds to know that they don't have it, or that they have it, even though we're not sure that if they did, they won't get it again. Right. But let's talk about why the testing regimen is so important, Mona.
I think you just touched on it perfectly. Right. It's, you know, ease of mind and people to take precaution, or if they are infected, you know, how do they not infect other people? And so I think this is the biggest, you know, factor in all of this, and bringing ease to people, and, you know, looking at the workforce as well, people going back to work. And it's just, again, you know, people having peace of mind.
Peace of mind, yeah.
But I think it's really important to emphasize that it's not just about the person themselves, it's about who they might infect. Sure. So there's a lot of people who haven't seen their parents, their grandparents in 2 months. Because we've been separated because of the home restrictions. And so now, you know, I can go see somebody. I'm not going to get my family member sick, which is really important. But I think to kind of wrap up what we're discussing here, it's the type of testing that's critical. As we looked in your population, 25% were positive for the antibodies, means a quarter of the community was infected, but only 5% were we were able to recover the virus by the nasal swab. That means that very few people are still able to infect others. A large portion of the population was infected, and that should give reassurance to a lot of people, and also let those know who didn't test positive for the antibodies, you got to stay vigilant because you're at risk.
Absolutely. So do you have any testing dates coming up?
We do. Every day this week we're going to be testing. We'll be back at it. Memorial Day is Monday, so we're going to take the day off on Monday, but back at it Tuesday. We're going to be across the city of Detroit testing. We'll share with you so you can post on your site.
We'll make sure we get information out there. And Dr. Levy and Mona have done a wonderful job. We're really blessed to have that partnership with them. We put them on all of our stuff, even though we tried to develop our own testing situation. But we'll be leaning on you again, absolutely. How do people reach your organization, Mona?
We have a person who is designated to take all the calls and make sure that if there's any scheduling for sites. So that's kind of how we've been centralizing it.
And is there a number?
Yes, and gosh, I
And
don't
a person?
Yes, Michelle for access.
Okay.
But
What's the main number to access?
313-842-7010.
One more time.
313-842-7010.
And we won't give a number for Dr. Levy. He's too busy. He's doing too much research. All right. Thank you so much. We'll be right back after this.
A new law, Public Act 33, was recently enacted, which will help low-income taxpayers avoid property tax foreclosure. This law is referred to as Pay As You Stay, or PAYS. It will allow those who are exempt from property taxes due to low income the ability to remove interest, penalties, and fees from their delinquent taxes and to pay their balance over a 3-year period. Even though our office is currently closed to the public, taxpayers who qualify will be contacted by my office. Their payment plans will be processed through the mail and with the assistance from our nonprofit partners. Please visit us at treasurer.waynecounty.com or email us at taxinfo@waynecounty.com for more information. And remember, we're here to help.
Welcome back. We got so enthralled with our conversation, we decided to have them back for another segment. The energy was high. The information was awesome. And I'm going to start with you, Mona. We had this discussion about whether or not there's a parallel between some of the health indices in the Arabic or Chaldean community, the African American, and you were telling me they don't count you guys as minorities. So your numbers don't mirror ours because they're not in ours. So
Absolutely.
Tell us about that.
So yeah, I mean, this has been a huge challenge when we look at, health issues and health disparities and looking at the data and the research that's out there. And this is one of the partnerships that we have with Wayne State, where we do community health research and at the community level to better understand the issues that Arab Americans face as well as others face, looking at cancer, looking at mental health, looking at, substance abuse, looking at all of these issues, hypertension and cardiovascular disease. But across the board, it continues to be a challenge.
Yeah, when I was in seminary, one of the first German terms I learned was Sitzenleben, which is setting in life. That when you deal with the text, you always have to take into consideration everything about the people who are part of that, and that's true for medicine as well. Doc, you and I talk a lot about the disparities and how this has really shown and demonstrated how that can impact quality of life and ultimately even death.
Absolutely. So as all your viewers know, hypertension, high blood pressure, diabetes, overweight, these are things that plague the African American community. And really, the question is why? So why do they exist? And there's a lot of structural inequities that contribute to that, a lot of unhealthful food access, limited opportunities for exercise in the community, the built environment being challenging for all of that. But beyond that, when folks do develop these conditions, it's really difficult to control them. And we often want to play the blame game and say it's your fault. But the reality is society and the medical community and the health systems have not set up the structure to help make people be successful on their own. And we teach everybody, you need to go to the health system, you need to go to the hospital to get well, but we don't tell people these are the things that we can do to support your wellness. Right. We have a system that really is one geared on illness and not focused on wellness.
And one of the things that I find almost amusing is all the news stories now from emergency care facilities and emergency rooms saying we don't have any patients because during this pandemic, people were told to stay home if it was elective and all of that. So we've always had a problem with people in our community using the emergency room as their primary care physicians. I wonder whether or not their absence in the emergency room means that they've been driven somewhere else or they're just not in the system at all.
I think that's a great point. So as an ER doc, I work at Detroit Receiving Hospital for 20 years now. I built my whole research career around saying folks come to the ER because they can't get health care elsewhere, let's provide all the other health care that they need, especially blood pressure and diabetes control. And now these folks aren't coming, so where are they going? And what we're finding as we do our outreach for our testing sites is that they're not going anywhere. They're not getting the care they need because the doctor's offices aren't open, they can't get their prescriptions refilled, and even though the governor with her executive order changed some of the rules of who can do what in healthcare, people just aren't getting healthcare. And so there's a big chance, a real likelihood that people will fall through the cracks, and everything that we need to happen to build up that resiliency to survive this virus or the resurgence of the virus or the next pandemic won't be there.
So Mona, this might be a great opportunity for you guys then as people come in through the testing regimen to determine if they have primary care physicians and do some follow-up. I know, Dr. Levy, from doing this testing, I'm getting calls from healthcare companies that want to, come in and, provide services. When I found out recently, I guess they can do almost a year of follow-up and bill for that. I mean, that's not my motivation. I know it's not yours. But what are you building in maybe to help these people on an ongoing basis, since you have an aggregation of folks who come concerned about their health? That's a start.
Absolutely. It's definitely an opportunity to really better understand the health needs of individuals who are getting tested. At Access, we have a wraparound model. So as I mentioned, we have over 120 different programs. So we're really looking at integration of care, looking at not only physical health and behavioral health, but also looking at the social factors and social determinants and being able to provide all of those services. But we did realize, and actually we started last weekend at our community site at Access, and we started asking those questions. Do you have a physician? Do you have housing needs, food insecurities, and all of these questions? And we had 45 people respond that they would want us to follow up. So we have a team now working to follow up with those individuals, but we also learned that, we need to continue this, right? Because when we have opportunities like this, that people are actually coming through and concerned about their health, that's a time to really intervene.
Wouldn't it be wonderful if we could have taken people's blood pressure and, some of those people trying to get tested may even be at a stroke level.
See, that's why you're so smart, Reverend, because we're doing that now.
Okay.
So yesterday was our first day checking blood pressures, and we found people were very interested in getting the blood pressure checked. And you know what? Every single person we checked, their blood pressure was high. It was high. And what we want to make sure amongst these folks is that it doesn't stop there. So a lot of these health fairs that occur, they say, you got high blood pressure. Good luck. Instead, we have to close the loop and say, you have high blood pressure, and we're here to help you henceforth. And I think that's really the key.
Well, I think one of the things as we close, we also had this conversation that faith in practice, or the praxis of our faith, has led us to do what we do. And we have different faiths represented here, different communities represented here. And the important thing is that we come together and work together not only in crisis, but also in prevention and intervention. So I'm so glad to have Dr. Levy and Mona Makki here from Access. We'll be doing a lot of great work in the future. And by the way, get tested, 313-706-2750, 313-706-2750. The life you say may be your own. Be right back after this.
Real talk, real talk, real talk. Take a walk down this path through Detroit. This is real talk, real talk, real talk. Real issues straight from the heart, Giving you real talk, real talk, real talk. Take a walk down this path through Detroit. This is real talk, real talk, real talk.
This is a part of our treatment of the pandemic, the coronavirus 19 pandemic that's stricken our city, and we've been blessed to have some folks who have made it possible for us to do the community-based testing we've done. We've got Tommy Nafsel here from 315.
Correct,
315. Let's start, first of all, with you. You'll give me a little information. You're a lawyer by trade.
Yes.
And tell us a little bit about your background and how you came to be a part of 315.
Absolutely. So I'm currently the general counsel of 315, wear some other hats on the operational side as well. My background, I was a prosecutor in Wayne County, spent some time in the Attorney General's office. Now with 315 Cannabis, handle just about anything you could imagine. It's a great company, largest retail brand in the state of Michigan, and more importantly, largest retail footprint in the city of Detroit.
Sure. And by the way, I want to thank you because you guys made a generous contribution to enable us to do the testing we're doing at Sinai Grace and at the Sheffield Center. We really appreciate that. So you've been in the prosecutor's office. Has that affected your view towards the legalization since you're in the business? A lot of young people's lives were wasted with a criminal imposition upon their records. Tell me, how do you feel about that?
Absolutely. So first, from my experience in the prosecutor's office, I saw that there was a big resource drain on prosecuting crimes that really shouldn't be prosecuted, right? And I think that was the big takeaway from the changes and the decriminalization, the legalization, is that you stop putting resources toward things that don't matter and focus on things that matter more. So that was very important. Then I think, as you've alluded to, is there's a community here that's been disproportionately impacted by being put in jail, spending time behind bars because of marijuana. So absolutely, I think at this time it's important that the people that have been victimized by that, been impacted by that, that they are given opportunities, they have a chance to be in the business, they can work in facilities, and be a part of them. And that's something across the state, not just in Detroit, that we're looking.
So now you guys, 315, you're in the marijuana, the legalized marijuana business. Are you in the medicinal purpose? Are you doing medical marijuana, or are you doing both?
We're doing both right now. So in the city of Detroit, it's only medical right now. We're looking forward to the transition to recreational, which should be coming sometime soon, hopefully, to be able to provide more access. But some of our facilities around the state provide medical as well as recreational.
So what the difference, of course, is there's a lot of research out there that suggests people with arthritis, and I mean it has a known impact on improving people's quality of health. Is that not correct?
Absolutely.
Yeah.
The medicinal benefits are really undisputed.
Particularly people who have cancer, who are on chemotherapy and stuff like that, I understand.
Absolutely.
Yeah. So you guys made a contribution to our testing team, and you want to talk about why you did that and what you think the impact will be?
Yes, we're always looking for ways to give back. 315 is, whether it's through volunteering by our team members or through programs that are put together, like community leaders like yourself. I mean, who better than you to lead a program that we know if we contribute toward, we know the dollars are going to go to the right place, we know the right people are going to be served, we know it's going to make a difference. So you've provided us that avenue. That's really been something that, as we're seeing it, as our team members are on site and looking at what these programs are, I mean, it's really incredible, from the testing to the in the inner city where where in the hardest hit areas, as well as the donations for groceries. I mean, we are seeing a direct impact, and we're seeing a program with our own eyes that's happening. So it was very important to us to be able to contribute to something.
And we're glad you did. Now we have LaGrasso, by the way. We have 1,000 boxes of produce and fruits and vegetables twice a week. So, and we distribute that all over the city. So your contribution enabled us to have drivers take it, drop it off at seniors' homes, as well as the testing, which is so important. People need to know their status. Now, you're also an employer. And I understand you have some opportunities for people who may want to work with you guys. Absolutely. Yeah, tell us all about it.
Absolutely, yeah. So we employ well over 60 people in the city of Detroit, several of which are Detroiters. We are looking to hire more Detroiters. It's very important to us that we hire from within the community, not just the immediate vicinity of our locations, but also the community at large. And these are not just patient advocate positions, which are the patient servicing positions, which are very important. We have assistant manager positions. We have one manager position available right now, and we're also looking to hire within the city of Detroit, because we are a Detroit-based company. Absolutely, and but to provide services statewide. Sure. So we are hiring for a brand ambassador right now. It's a very important position for us.
What is a brand ambassador?
That's somebody that interacts very directly with the community. Right now, it's something that is happening at the store level. There's direct engagement, but we also create accountability as it relates to how we're interacting with the community, what we're doing, what kind of
kind of like community relations.
Correct.
But affects your brand as it relates to how it's seen in the community.
That's correct.
Okay, which is kind of what you're doing here, quite frankly.
Yes.
Yes.
Right. Yes, and we want somebody that's really ingrained at a granular level. And yeah, that's an important position. So if anyone wants to,
how do they apply? How do they get the information? We'll put it right on the screen. Give out the phone number, email address right now if you like.
Yes, absolutely. So if they can send any resumes to info@315.com. So it's info@315 spelled out.com. Okay. And we're getting a live link for jobs on our website that should be up soon, which is 315.com.
Yeah, so you're in the city of Detroit. All your businesses are here now. You plan on expanding. We're very grateful. I can't say it enough. You know, we have people that make donations, not necessarily as significant as the one you did, and they just give their money and that's it. And they feel good about that. But to have the direct involvement that you've talked about having and knowing the folks who are behind this makes a real difference. So how is the medical marijuana business faring in this pandemic? Have you been shut down, or are you still able to supply to the folks who have medical needs?
Yeah, no, we've been able to provide. We've implemented curbside pickup as well as delivery. So almost overnight, we had to adapt and really become more of a web-based company than anything else. So people could place orders online, or they could pull up and we could, hand them a menu and they could make their orders. It was important that the staff adhere to social distancing and all of the other preventative measures to make sure that there were no issues. Our staff is excellent. I mean, second to none. We have, I don't think we lost any people during this time. No, nobody quit. People stayed on. We didn't have to let anybody go, which we're blessed and we're thankful for, and that's a big reason why we want to give back too. And so during this time, look, it hasn't been there in the media. It's like there's a huge increase in business. We didn't see that. It was probably down a little bit, but we're happy to be support. We're happy to be an essential business that could.
So tell us where you're located again. People who are watching 315, give out the information about the jobs again, and then you ought to patronize these folks. These are people who are giving back to the communities where they are engaged, where they do their business. They're not just taking money out and going on back to wherever, but they're really engaged. And this is an important thing for them to contribute to, testing. And we really appreciate 315. So tell people where your locations are and how they can apply for a job.
Absolutely. In the city of Detroit, our locations are at along 8 Mile on Gratiot, from east to west, Gratiot, Shaner, Hoover, and Losser. And for those looking for jobs, we have jobs available for basically any position at this point. They can be sent to info@315.com. That's info. Resumes can be sent there rather to info@315. Info@315.
All right, we got about 1 minute, so I want you to tell people why it's important for them to be tested and why you decided again to contribute to that endeavor.
Absolutely, and testing is very important. It's important to know if someone's infected, how they can quarantine, how they can make sure that there isn't a continued spread. For us, it's great to help. It's great to be working with Reverend Sheffield and to take part in the effort he's leading and make a difference.
So I want to let you know this is not part of a community benefits agreement. Many of these places have to give money to folks in local communities. This is something they've done on a corporate basis because they agree with what we're doing, and someone introduced them to me. We look forward to them being a long-term partner. We know there's a lot we do here and a lot we have need of. Tommy, we thank you so much. 315, go see 315.
Detroit, this is real talk, real issues straight from the heart, giving you real talk. Take a walk down this path through Detroit, this is real talk.
Hello, Detroit. I am City Council President Pro Tem Mary Sheffield, and I want all of you all to know that during these very difficult times, my heart, my prayer, and my thoughts are with you all. I want to extend my condolences to anyone who has lost a